Today, we're going to look at how one company isn't just building a business, it's actually building a healthier nation from the ground up. This is the story of Novala Biotech and their mission to completely revolutionize healthcare in Nepal. I mean, think about it. It's a huge question, right? Real health security isn't just about having hospitals or doctors. It's about having the tools to find out what's wrong, fast and reliably. It's about self-sufficiency, being able to handle a crisis yourself without having to wait for help to arrive from somewhere else. And that's the core challenge that sets the stage for everything we're about to talk about. You see, for a long, long time, Nepal's healthcare system faced this one massive hurdle. It was critically dependent on other countries. And when all of your most important diagnostic tools have to be imported, well, your entire public health system is just incredibly vulnerable. And this, right here, lays out the stakes perfectly. On one side, you've got that import dependency. That means relying on foreign test kits, dealing with shaky supply chains, and using solutions that probably weren't even designed for the specific health challenges in your area. But on the other side, that's local innovation. That's the power to create solutions tailored to your own people, to build a self-sustainable healthcare system, and to really, truly strengthen a nation's health security from the inside out. So, who steps up to fix this? Well, this is where our protagonist enters the scene. Novala Biotech was created to tackle this exact problem head-on, with one crystal-clear goal: to move Nepal from dependency to independence. And they really don't mince words about it. This isn't just about making and selling some test kits. No, this is a mission to fundamentally change the entire healthcare landscape of a country. It's ambitious, it's incredibly bold, and you know what? It's desperately needed. So, how in the world do you even start a mission this big? Well, you start with the absolute right people. The foundation of Novala is this incredible, multidisciplinary team of experts. Let's meet the people making it all happen. At the very top, you have the chairperson, Dr. Sunita Gautam. She's a molecular biologist, and her expertise is absolutely central to developing these kinds of advanced diagnostic tools. Working alongside her is the scientific director, Dr. Ravindra Sapkota. He's an immunologist, and his role is critical in making sure every single test is as accurate as it can possibly be. But a scientific breakthrough is pretty useless if it just stays in the lab. That's where Kabin Malegu, an industrial pharmacist, comes in. He's the one who turns that brilliant lab work into real-world solutions that can be produced at scale. And to make sure these products are actually effective out in the real world, in clinics and hospitals, you have Dr. Prabhat Adhikari. He's an infectious disease specialist who guides their practical application. And rounding out this powerhouse team is Bikyat Shrestha, a clinical geneticist. You see, it's this amazing combination of deep, varied expertise that really drives this whole company forward. Okay, so you've got this world-class team. What have they actually created? They've built a whole toolkit of diagnostic tests designed for Nepal by Nepalis that are validated, totally reliable, and ready to go. And here's the most important part. For a diagnostic test to be worth anything, it absolutely has to be accurate. There's no room for error. Novala's commitment on this front is intense. Every single product goes through rigorous in-house testing, and, this is key, it's also validated by public laboratories to guarantee it performs exactly as it should out in the field. And the proof is right here in the results. I mean, just look at this table. For some of the biggest public health concerns, dengue, HIV, COVID-19, syphilis, hepatitis B, their tests score high across the board. High specificity, which means they correctly identify people who don't have the disease, and high sensitivity, correctly identifying those who do. That's the mark of world-class diagnostics, right there. But their portfolio goes so much further, covering all sorts of everyday health needs. They produce essential tools for things like family planning, like the LH ovulation test, and tests for common childhood illnesses like rotavirus. They've got rapid diagnostics for bacterial infections like strep A, and even tools to quickly identify widespread diseases like typhoid. And honestly, this is just a quick peek. It really shows you how comprehensive their toolkit is becoming for the entire country. So what does this all add up to? I mean, it's great to have the right team and the right tools, but what does it actually mean for the average person in Nepal? What's the real-world impact of all this work? Well, it means everything. It means improving patient outcomes because doctors can finally make faster, more accurate diagnoses. It means advancing medical practices because now healthcare professionals have access to modern tools. All of this leads directly to enhancing the quality of life and ultimately to ensuring the well-being of the entire population. That's the real payoff. Yeah, this quote pretty much says it all, doesn't it? It's not just about running a business, it's about creating tangible positive impact. It's about a fundamental step forward in how healthcare is delivered in their country.
And that leaves us with one last, really powerful question to think about. The story of Nepal Biotech is this remarkable example of local innovation solving a critical national problem. So, what if this isn't just a story about Nepal? What if it's a blueprint for other nations around the world? A blueprint for how homegrown scientific expertise can build a more secure, self sufficient, and healthier future for everyone.